Chronic kidney disease is a progressive, irreversible loss of kidney function. Many individuals are underdiagnosed and go untreated. The signs and symptoms appear gradually over time. In the assessment process, some of the information we will gather is a complete medical history, a medication list, their diet, determine the loss of kidney function, and the GFR. Some of the risk factors include uncontrolled hypertension, uncontrolled diabetes, their age, obesity, family history such as polycystic kidney disease, exposure to nephrotoxic drugs, glomerular disease, and smoking. Some of the signs and symptoms include increased urination, high levels of urea in the blood, proteinuria, and fluid retention causing edema. In the planning phase, we want to be sure to slow the progression by treating the cause. We want to maintain as much kidney function as possible. So we're going to treat the diabetes. We're going to treat the hypertension. We're going to come up with a plan with the patient and determine the best way to treat those conditions to try to get them back on course and again slow the progression of any additional kidney function. We want to involve the patient in all the decision makings. We want to provide them and family members with effective coping strategies. We're going to encourage them to participate in their ADLs. We're going to teach them how to do daily weights, how to monitor their input and output. We're going to teach them to start with a low protein diet before dialysis. And if they were to be placed on dialysis, they would increase their protein intake. We'll discuss options of a kidney transplant list and if they qualify. We will determine the GFR stages. So stage 1, greater than 90, you have healthy kidneys. Stage 2, stage 3, we will continue to monitor the patient in those stages. Stage 4, they're in kidney failure and we want to prepare the patient for dialysis. And stage 5 is less than 15. When you have CKD, it is important to watch what you eat and watch what you drink, since the kidneys cannot remove waste products as they should. By eating a healthy CKD diet, it may improve the chances to slow the progression. A kidney-friendly diet will also help with cardiovascular diseases and diabetes. The right balance of nutrients will also help maintain a healthy weight. The patient will be referred to a dietitian where they will be introduced to a DASH diet with fruits and veggies, whole grains. They will teach them to restrict sodium, potassium, phosphate, low-fat dairy products, how to avoid prepackaged foods. Many prepackaged foods are high in sodium. They will teach them about doing a daily weight every morning and to also monitor the input and output of the fluid intake. The fluid intake is important because it will help indicate to the patient if they are retaining any extra fluids, since their body is perhaps not removing the fluids and the waste products as it should.
Medications and treatments. There's no cure for chronic kidney disease, but treatment can help relieve the symptoms and stop it from getting worse. Our treatment will depend on the stage of your chronic kidney disease. The main medications to treat are not used to cure, but used to control associated problems, such as hypertension, high cholesterol, and anemia. Good control of blood pressure is vital to protect the kidneys. People with kidney disease should usually aim to keep their blood pressure down below 140/90. There are many types of blood pressure medicines, but medicines called ACE inhibitors are often used. Examples include rampapril, enalapril, and lisinopril. People with chronic kidney disease have higher risk for cardiovascular disease, including heart attack and stroke. This is because some of the causes of CKD are the same for those for cardiovascular disease, including high blood pressure and high cholesterol. You may be prescribed medications called statins to reduce your risk of developing cardiovascular disease. Examples include atorvastatin and simvastatin. Anemia is caused by a decreased production of erythropoietin, and this is related to the staging of your CKD. If you have anemia, you may be given injections of a medication called erythropoietin. This is a hormone that tells the body to produce more red blood cells. Labs. Understanding your lab values is important for people who develop chronic kidney disease. They may have the following tests and many more. If you have kidney disease, it is important to ask your doctor which tests you will have and how often they will be done. It is important to note that precipitating factors, for example diabetes, could increase the frequency of these tests. First is BUN, blood urea nitrogen. Urea nitrogen is a normal waste product in your blood that comes from the breakdown of protein from the foods you eat from your body's metabolism. It is normally removed from your blood by your kidneys, but when your kidney function slows, the BUN level rises. BUN can also rise if you eat more protein and can fall if you eat less protein. Serum creatinine. Creatinine is a waste product in your blood that comes from muscle activity. It is normally removed from your body by your kidneys, but when the kidney function slows, the creatinine level will rise. Your doctor should use the results of your serum creatinine test to calculate your GFR. Urine protein. When your kidneys are damaged, protein leaks into your urine. This simple test can be done to detect protein, and if it persists, it's usually an early sign of chronic kidney disease. Hemoglobin. Hemoglobin is the part of red blood cells that carry oxygen from your lungs to all parts of your body. Your hemoglobin levels tell your doctor if you have anemia, which makes you feel tired, have little energy. Diagnostic tests. What tests do doctors use to diagnose and monitor for chronic kidney disease? To check for CKD, healthcare providers use a blood test that checks how well your kidneys are filtering your blood, called GFR. GFR stands for glomerular filtration rate. Providers will also use an evaluation test for urine that will check albumin. Albumin is a protein that can pass into the urine when kidneys are damaged.
Lifestyle modifications for a person living with chronic kidney disease are a very important part of treatment to stop the disease from progressing. Hypertension can cause more kidney damage, so it is important to try to keep your systolic number less than 120 and your diastolic less than 80. Sodium restriction varies from 2 to 4 grams a day. The DASH diet is good for this. If diabetic, you should try keeping your blood glucose levels anywhere from 70 to 100. It is important to maintain adequate nutrition. Protein intake should be limited until dialysis is initiated. Potassium should be restricted to 2 to 3 grams per day. Eat plenty of fruits and vegetables and keep your fat content low. Maintain an exercise plan and lose weight if indicated. Stop smoking and limit or eliminate alcohol consumption entirely. Ongoing reevaluations include having blood work done regularly. These are some of the things that you will want to monitor: BUN, serum creatinine, creatinine clearance, GFR, microalbumin urine test, urine protein test, hematocrit, hemoglobin, glucose, and hemoglobin A1C. The other things to reassess would be to check for compliance of diet and medications. Are they coping well? Do they have a strong support system? Some of the nursing interventions for chronic kidney disease are frequent monitoring of hydration and output, cardiovascular function, respiratory status, electrolyte imbalance, proper nutrition, mental status and emotional well-being of the patient. You want to ensure proper medication regimen and make sure it's being followed. You want to make sure they have adequate skin care. You want to do patient teaching on bleeding problems and what to avoid, care of the shunt if they are receiving dialysis, and education to the client and the family. Health promotion is very important. You want to identify people who are at risk for CKD. You want to promote regular checkups with urine analysis and GFR checks. You want to know what to report to the PCP and educate the patient on doing the same and what to look for. Patient teaching on medication compliance and diet restriction is important as well. Overall, you're helping to prevent the progression of CKD if at risk.